I think we are ready to go, guys. And today, what's up? Welcome, everyone. Again, another episode of The Conspiracy Farm. I am always your host, Mr. Jeffrey Wilson, co-hosting with UFC champion, my buddy, Mr. Pat Miletich. What's up, sir?
Good to be here, man. We're going to have a great show today, buddy. I'm excited. Yeah. I'm directly connected to this one, so I like it.
Absolutely, absolutely. This is another one that kind of goes deep down the rabbit hole, folks. Today on the program, we have an individual. He is a nurse practitioner. He is a diplomat with a fellowship in metabolic disease management. He heads up ACI. ACI is an organization which identifies substances that are in the human body that need to be removed, or even identifying substances that need to be there and an individual might be deficient in. Ladies and gentlemen, please welcome to the program, Mr. Shawn Snider. How you doing, sir?
Yeah, doing good. Thanks for having me.
Absolutely. No, thanks for taking the time. And so this is a very fascinating subject because, you know, you get into food, you get into how people eat and what they eat and what it does to the human body. You know, Hippocrates said, let food be thy medicine and medicine be thy food. And that doesn't seem to be working with a lot of people. And a lot of people, you know, they're very deficient in a lot of things. Now, you happen to work with people from your random citizen, finding out their deficiencies, up into elite athletes in like Major League Baseball, as well as the elite athlete that we have co-hosting the show with us today, Mr. Pat Miletich, was one of the individuals that benefited from your expertise. If you don't mind, you or Pat, tell us how that marriage came together and exactly what you do, and a little bit about ACI.
Well, I'll do this. I'll talk about how I was turned on to Shawn. A good friend of mine told me about him and that I should go see him, and then he can elaborate maybe on how he specifically helped me, I guess. But and other individuals, and we'll get into a lot of other things that people need to know about, I think, in terms of their health, nutrition, supplementation, everything else that I was completely, after being a professional athlete for 20 some odd years, was completely naive to. I thought I was eating healthy, you know, whole grains and this and that, and complete misconceptions about what I was putting in my body. But for the past 15 years, I had been dealing with massive pain, arthritis, literally couldn't stand in the same spot for 2 minutes without needing to sit down from pelvic inflammation, and thought I had sciatica and everything else, and just miserable. And I thought all of my problems, including, you know, my breathing problems and everything else I was having, was from damage that I received fighting professionally for so many years. You know, I had a lot of kickboxing matches, Muay Thai, and mixed martial arts matches, and along with playing, you know, impact sports wrestling and football my whole life. So I just thought it was damage that I had incurred, but Shawn ran some blood tests on me, and it took 2 times of him talking to me for me to finally realize what he was saying to me. Apparently, I got hit a lot and wasn't paying attention. But you know, he basically said, you know, you've got a couple forms of arthritis. You know, your respiratory is being affected, your digestive system is being affected, which is because of the stomach producing certain chemicals are going to affect your thinking, your brain. You're not thinking clearly, you know, foggy brain and everything else. There's so many things that were tied to it. And he said, basically, you've got to quit eating wheat and soy or gluten. That's the cause, the root of all your problems. And literally, once I stopped eating it, a week later, I had no more. And you got to remember, I was a guy that, I mean, I would jog 3 miles and I'd be crippled for 2 days. I'd just be in complete total pain and could hardly walk. So, you know, the fact that a week after I quit eating these foods, excuse me, I could run and I didn't have muscle soreness. I didn't have fatigue in just 1 week. And I went from running 3 miles and being crippled to a couple weeks ago I ran 45 miles. And granted, I was tired for a couple of days, but I didn't have real muscle soreness or anything after that 45-mile run. So Shawn obviously knows his stuff, and that's why I felt very important to have him on here. And maybe Shawn can elaborate on some of the stuff that I had going on with me and how he helped me.
Yeah, that's in putting it very simply, you know, you said exactly what was going on, and I think you know, you asked also to what exactly ACI does. Well, we do a very good job of diagnostically looking at things, trying to figure out root causes of problems. It takes measurements that you know, require gathering samples, whether it's, you know, blood or or urine or whatever it may be, and then pulling out what kinds of individual markers we're looking for to see if we can determine the root of the cause. And in this case, we were talking about with gluten and with gut, obviously there were some inflammatory markers that were looked at. There were some substances produced by bacteria in the gut that were looked at, and also antibodies that our body's immune system produces, a fighting force, and these antibodies then were signaled to attack gluten, which is a substance that holds together grains. And so in this, every time there was exposure to gluten for Pat, it would increase the inflammation from these antibodies. So really going right back into the gut at the cause, or at the root of the problem. So that became immediately the focus for the inflammation, which is true for a lot of athletes.
Well, Shawn, I've got to ask you, when I get blood tests done at my family doctor, they don't take that much blood from you, number one. The tests aren't that extensive. The tests that you did on me, you took, I don't know, 20 vials of blood compared to 2 or 3 maybe at a family doctor or at a lab just looking for basic stuff. Why do you need that much blood, number one? And two, what are you looking for? The list of stuff that you're looking for in the amount of blood that you take, the number of tests that you administer to that are obviously very extensive. After showing me the grid, the amount of stuff that you test for on your computer screen, I obviously I'm very confused by it. I'm a layman, but maybe you could go through and explain all of that stuff and why it needs to be so extensive and what you're specifically looking for.
Well, I think and mostly what's true for athletes in general, but also with our population, is the amount of stress that people are enduring. The stressors of 300 years ago are a little bit different than they are today, but the body's response is very similar. For instance, we make a hormone for long-term protection of from stress and damage, and that hormone that we make is called cortisol. It needs to be made in the adequate amounts. It doesn't need to be made higher than human range. It doesn't even mean those amounts, that can be very damaging, especially to brain. But it needs to be balanced, like right in the middle. So I think in starting with it, looking at stress and how it impacts the rest of the body, that's at the root. Where we need to determine, what the cortisol value, what those values are through the day, and then, the other 2 organ systems that are tightly related to the adrenals or that cortisol are the pancreas, which is insulin and sugar control for the most part, and also digestive enzymes, and then also the thyroid, which is the gas pedal for the metabolism. So you see these metabolism problems, and leads to other issues like the high cholesterol and the high cholesterol particles, and the damage to the blood vessels, and inflammation, and also blood sugar elevation, insulin resistance, diabetes, all these kinds of things. And if you haven't looked at the root of that metabolism, those 3 organ systems, then you're going to end up possibly missing the big picture there, and chasing after those end results or manifestations. In other words, given a pill for cholesterol when actually the metabolism should have been looked at first. The person's under a tremendous amount of stress. The thyroid is not functioning properly, or it's being blocked to conserve energy, and so what we're seeing really is a compensation more than a disease there. So that particular complex needs to be looked at. And then all of the other steroids that are produced from the, and very generally, there's a lot of symptoms, a lot of function and responsibility of these messengers that our body produces in order to keep it functioning appropriately. And if we're deficient in any one of those steroid hormones, there's going to be some problems. See, there really is no advantage to any hormone being out of balance, whether it's too high or too low. There's going to be some adversity with either way. So hormones are very important. Steroid hormones are those that are made of cholesterol. Those are all of them are important. So we have to look at all of those, and we have to look at that metabolism. So those are first and foremost. But in an athlete, we want to take a look at what is the capability of their heart to take up oxygen, and at what point do they hit their thresholds where they're moving from burning from fat into burning sugar and forming lactic acid. Because if we can know those markers, if we know those exact plotting points of where the heart rate is when those occur, and we also know how much oxygenation is being brought up by the heart, then we can help to train and get whatever the sport is to help the athlete hit those targets, and also what they're capable of or what their current shape is.
Yeah, and what you're just describing, that would be when you would apply a Vo2 Max test?
Yeah, that's correct. Correct.
Okay.
Uh-huh.
So explain the Vo2 Max test for people who aren't even remotely aware of what that is.
And it basically has two sensors in it, one that analyzes overall air and one that analyzes the oxygen. And so it really what the device is, it's like it has a mask, and it has a tube connected to it, and it goes to this analyzer, and you're at rest. The instruments have the capability of measuring through oxygen and CO2 what exactly the caloric demand is, or what how much you should be eating and consuming on a daily basis. That takes around 10 minutes, and then it calculates that out. And the next step of it is to figure out during activity what the metabolism, what that need is, and also determining then that VO2 max anaerobic thresholds, and that's done on a gradual increase of activity. I use a matrix treadmill to gather data, and I just gradually increase the incline until we achieve the heart rate at which those plots can be gathered or taken. So those oxygen sensor, the overall sensor, and then the oxygen sensor have the ability then to help us plot ranges in heart rate and calories and all sorts of things like that. So it's a fundamental test, really. I mean, if I've always said I wanted to take like a high school team and just use VO2 tests in order to put the athletes in the positions where they're most suitable based on the findings of the VO2. And see what kind of
like a football team, D-backs, quarterbacks, running backs, linemen, all that.
Yeah, correct. Just to kind of play a little chess game, see what happens, on a little scrimmage. But it'd be kind of interesting to see that. But it's very important.
Yeah, I can see that. And then going back, I'm dissecting some of the stuff you've already said when you talk about a doctor putting you on cholesterol medicine when other things should have been looked at beforehand. In my case, I was literally on the verge of saying, all right, I'm going to go to the doctor and I'm going to get medicine for arthritis because I can't do this anymore. This is just, and I would be on, who knows, God knows what or how many arthritis medicines right now had I not come seeing you. And then all of those medications, and for numerous health issues, you name it, doctors just prescribe these drugs to mask the symptoms instead of going to the root cause of what you do and what other people that specialize in your field do, and get rid of the real reason that these things are happening in the first place, which is, it's amazing to me the way, and I've always been a health conscious person, how even I've been brainwashed into thinking that I was ready to go to a doctor and get these medications prescribed to me for the pain, and I'm just, by the grace of God, I got lucky and found you and had somebody point me in your way. But I mean, go into that a little bit further about all the different drugs that people are taking and all the side effects and everything else.
Yeah, I think and that's a good point. Victims, I call a lot of the clinicians today. I think that, and genuinely they do want to help, and they're good people. It's just that a lot of times I call it a victim of the system. They're victims of the system. It's very difficult, especially in an insurance model, in order to spend the time that it takes to be with somebody, to truly understand their needs, to hear them, to do a thorough examination, and to come to look at all body systems how they're interrelating, and then going after it. So it becomes very tunnel vision, to where, the clinician is chasing after just well, tell me what you're here for. What's the main thing? That's all I have time for.
Well, that's what I was going to ask too. I hear because of that model, the average time is like 7 minutes that a doctor gets instead of like 2 hours, which is like the real in-depth.
Correct. That's correct. Yeah. So, if we can get, once everything, and without getting too much into that medical model and that, and what's going on with that today, but if in this, I've got for a small business, and my solution seems to work. It works well, and it keeps it affordable, and I can spend time and enjoy spending time with people, getting to know them very well. And
right. So when I had a guy, the guy's a bartender, but he's also a personal trainer, and at one of the hotels that I stay at when I travel for my broadcasting jobs, and I was talking to him in the restaurant, and the guy's really fit. He's lean, he's vascular, just really striated and in shape, and does a lot of different type of stuff exercise wise, and he's very knowledgeable. And he said, are you eating medium chain triglycerides? And I looked at him probably like a dog hearing a whistle for the first time. I tilted my head sideways and said, what the hell is a medium chain triglyceride? But he said, look, this is where you can get it in grass-fed unsalted butter and coconut oil. Cook with it. Put the butter in your coffee. Whatever. Any way you can, get it in your system, because it's going to assist you in absorbing the nutrients from your food better. You're going to feel a lot more energy. Explain what the hell those are, number one, and two, why they work so well to give you more energy.
Well, they give it it's like a shuttle system. And what you just basically said is, you can improve absorption by, it's kind of a taxi across the membrane in the GI system to pull those back into the body and into the bloodstream, where then they can travel to the tissues, where they're necessary for, what you said, normal function and control of inflammation. But that's exactly the triglyceride chains. They're a transport system, and most of your good quality fish oils will, in order to improve their absorption, will have an added triglyceride chain in order to bring it across, to help it travel through the system.
Okay. Well, I appreciate that explanation. That makes it a little easier to understand in layman's terms. And I'm sure there's a lot of people out there that, after hearing that, will get it and understand it. Going back to the food pyramid, when we talk about the fruits, and, for me, I don't understand necessarily, I have an idea, but glycemic load, glycemic index, and once those are established, how fruit would be classified correctly, as you put it, in that food pyramid, then based on glycemic load and the index.
Yeah, if you're consuming, glycemic index is referring to how much you're going to see in a spike in insulin post consumption of the food in a set time frame, and the glycemic load is how much of that is going to be delivered. I kind of look at that as how much of it dumps into the blood over time, and again and again and again. Like an example of a food that has a very high load and a high index is a piece of white bread. It has the same amount, of carbohydrates as a piece of bread that has a lot of capsulated grain, but it has the ability to spike insulin pretty quickly after consumption. If you check that blood sugar in a half an hour and an hour, you're going to see a rise, 100 over 100 very quickly, 110, 120, depending on the person. And so that it's not a slow release. It's not the index of that food is based on how quickly that absorption and how quickly that sugar, how quickly we have a rise in blood sugar in the bloodstream. After consumption. So the more you take oranges and you take orange juice, very different indexes because of the fiber. It slows down the sugar going into the bloodstream. So that's the index, and we really want to keep indexes, in between really healthy foods, at 50, be a good cutoff. The food should have a glycemic load less than 10. Popcorn has a high index and a very low load. so it could be an acceptable source of food with a lot of antioxidants and fiber in popcorn. So that's one of the food examples. If you follow just an index, you're going to end up eliminating a lot of foods that don't necessarily need to be eliminated. Rice is another one.
Right.
So it's just the encapsulation on the food slows the index, and the amount of sugar that's contained that will keep dumping into the bloodstream, that's the load. So you want to consider both of those.
Okay. So, I find a lot of people have a lot of health issues. They're drinking, Diet Coke, Diet Pepsi, all these artificial sweeteners in them, and they're still having problems. They can't lose weight. You see somebody that drinks this stuff. One, they're completely addicted to it, but two, they still can't lose weight for some reason. And is that just give artificial false flags to the pancreas, or what gland that activates anyway and screws up the system? I know that I've heard people talk about it. I haven't had them explain it in depth, maybe, and maybe you could help us out a little bit with that.
Yeah, some of them, like for instance, the yellow stuff, that one has a tendency to displace the thyroid hormones.
And you mean in the yellow packet when you say yellow stuff?
Right, yellow packet. Sorry, yeah. So that anytime that you're disrupting some of those thyroid hormones, you're going to slow that metabolism down, and that has an impact on the insulin. So that it's kind of that's self-defeating in that way. Some of them have impact on the brain as well. So you really want your insulin to be working well, and artificial sweeteners and displacing thyroid hormones for one, metabolism. Probably not the best thing to be doing, and especially when in a diabetic. Can they handle small quantities? Probably so, but there are lots of other fine alternatives that don't do that and actually have a lot of health benefit. The one that comes to mind, the one I would recommend the most, is xylitol, which is the sugar that's found in Trident gum to prevent dental caries. It comes from corn cobs and tree bark, but it has a more of a cellulose sugar, and alcohol sugar too would be good, that we can't absorb very well. And so the glycemic index is around 7. So after consumption, we're going to see the peak spike of insulin at 7, which is really not, it's insignificant. It's not going to cause any real problems or any real demand. The downside to using a lot of it, like if you make Kool-Aid with it, then you're probably going to spend the whole day on the toilet. So make sure that it's used in small quantities, and I wouldn't recommend it for when it calls for a lot of sugar.
Right. Well, what if somebody's using, say, just raw brown sugar, where it's not been processed much at all? Yeah. I mean, is that also bad for you in small amounts, or is that tolerable?
Well, it depends on the. Yeah, there's stevia has mixed results, in literature, whether it's beneficial or in the long run on insulin, and is it a healthy alternative? So mixed reviews on that. I'm still not 100% sold that should be the way to go. But I'd rather use something that's naturally found on the planet in its unrefined form. To go back to the question there too, and Pat. Anytime that you start refining and breaking something down from its natural form, then you're automatically, and when we're talking about sugars, you're automatically increasing the insulin surge that's going to follow as it gets into the bloodstream very quickly, and surges it. Yeah, so we want to slow that down as much as possible, and really adding sugar to things is, if we can, once somebody's eliminated that sugar from their diet, a lot of people do crave the sugars, and live on that. In one, high fructose corn syrup, which is interesting, doesn't need insulin to get into a cell. It just kind of shuttle rockets in there, which increases insulin resistance. And that's a lot of our kids' foods are loaded with high fructose corn syrup. Well, a lot of foods in general and processed foods, but if we eliminate those sugars and replace the sugar that was once there with fats, like tree nuts, the cravings and curve, they're curved for that. And actually, you can go without the sugars. And elimination of the sugars over time, 3, 4, 5 months, and then entirely going with just very clean fibrous carbohydrates during that time frame, and then adding in, say, a handful of berries. They're going to taste like you just ate a bag of candy. The amount of sugar that's in the naturally occurring foods should be adequate.
Shawn, something that you explained with me with the gastrointestinal system, the belly to brain, how they basically your belly, your stomach, your digestive system is your second brain, because the chemicals that are released by your digestive system directly influence your thought processes, mental mood, fog, everything else. Those genetic mutations in our bodies. Explain to the people out there who have no idea, which I had no idea about this stuff, how the mind is affected by what you're putting in your body and the chemicals that are being released by your digestive system.
Well, I'll use a current event example on that, and for those who watch CNN and Fox and Fox News would have seen the coverage on this. Well, it's probably been, I don't know, must have been early March, I'm guessing, of this year, where the Germans had the findings of their. It was a very good study design. The results of this study that they looked at what's called a proton pump inhibitor. That's like your Prilosec, Prevacid, those kinds of acid reducing medications that are seemingly harmless when they're over the counter or they're handed out. I've got a little reflux, I'm going to go ahead and take this. So medication, because it's very harmless. It doesn't have any side effects. At least when I take it, I don't notice anything except my reflux is gone, or I don't have heartburn anymore. Well, the results on that study, from the German study, shows that it's over 40%. I want to say it was like 43 or 44%. It's one or the other. 43, 44% increased risk for Alzheimer's disease in the elderly with the use of those medications. So what we're talking about there is a decrease in your vitamin B12 is one thing. Impairing magnesium, impairing vitamin D. The amyloid beta, or beta amyloid that's in the brain, that's what stimulates and causes the initial issue with the Alzheimer's and increasing the insulin resistance in the brain is also the other underlying issue there. So those folks who were predispositioned for diabetes based on their genetics had taken this antacid, and the theory on it is, and it's not just my theory, is that we're seeing eventual issues from the gut permeability, where it opens up and allows things to travel back out of the gut into the bloodstream. And one of those is a very specific species of E. coli that travels in and has the ability to cross over the barrier there to the brain and to stimulate some of these beta amyloid plaques. So that's where, in one way, that bacteria can influence or can create some problems depending on the genes. Where here somebody with just a genetic risk for dementia has increased that risk unknowingly. So that's the gut and brain and immune. That was just that was one illustration on that. But there's also another component, or another group of factors that need to be looked at too. And I do this a lot of times with the athletes and with the kids and people who have any of these symptoms. They focus problems, sleep, mood, metabolism, which is basically energy. Any of those kinds of issues, which is quite a few people, or any mental illness or depression in the family as well, is a group of genetic mutations. In other words, there's some parts of what makes a human is DNA, and you're seeing some of the mutations in certain areas and genes that you inherited from your family members. Almost a defect, if you want to call it that. It's a defect. And when you have any kind of defect in certain genes that I'm talking about, it can impair your body's ability to take things from your nutrition and convert them into things that are useful or required by different areas of the body, like the liver, the brain, lungs, a lot of the things that we need in order to have better metabolism or to have brain chemicals created that need to, which a lot of them are made in the gut, by the way. But these mutations can affect things like vitamin B12, vitamin B6, can affect what's called glutathione, which is a very, very strong, powerful antioxidant and important for brain and liver. It can affect fats that we need, like what's called phosphoserine or phosphocholine, fats that are needed in order to keep focus and help you sleep, keeping cortisol levels down. There's also some problems with the inability to break down histamine, which can cause a whole variety of body symptoms throughout the body. Histamine release occurs generally when you're around something that you're intolerant to. So not being able to get rid of that histamine can give a lot of signaling that generally you wouldn't see. So it's important to test those genes, look for mutations that are going to tell us a lot about nutritional status and possibly what things may need to be supplemented in order to prevent diseases. Like stroke is another one, B12, 6 folic acid. If there's a problem in a mutation in one of those genes, you increase your risk for stroke, regardless of what the toxins are. So it's important to understand and know that if you're going to prevent that, you might not even have any idea of what you need and how much of it. So it's kind of anytime I'm going to do a nutritional plan, I really want to take a good look at all these areas of the body. Otherwise it's really kind of cookie cutter, and I don't think that works very well.
So going back to going back to Alzheimer's and dementia, which is a massive problem right now, a lot of people having to deal with it. Not only does dementia destroy that person's life, or Alzheimer's destroy that person's life, but many times it causes huge problems for the spouse and the family. I mean, it can really wreak havoc on people and even kill the spouse because of the stresses and stuff that, of caring for that person. The people that don't have money to put their spouse in a home specifically designed to take care of them. So honestly, when I hear you talk about it, and I've heard other people talk about this with the causes of it, do you think it's reversible, number one? And two, if you think it can at least be lessened, what natural processes would you use? What supplementation, things like that, would you use to try and bring that person back?
Well, to answer the first part of that, is it reversible? Well, I think genetics, genetic predisposition, say like what's called an APOE gene. If there's if you're inheriting part of that risk, then that's what it is. And if you have it from both sides, then you're inheriting risk. So what you do with that then is look at, well, what associations are there that increase that risk, and we want to eliminate those things first. And foremost, lifestyle. Those kinds of things that are modifiable, eating healthy foods and not smoking and getting adequate sleep and all, those are all important. We have to consider all of those other traditional components as well. But the main thing for Alzheimer's disease is to make sure that insulin's working well in the tissue. That there is no insulin resistance, because it's a type of diabetes. It's not your traditional types. It's some considered type 3, some considered type 4, depending on which discipline you're talking to. But at any rate, it's insulin that is not functioning appropriately in the brain. So we have to keep insulin working well. That's through controlling stressors. That's through thyroid optimization. And it's also through keeping the cells sensitive to insulin by food choices. And if there's genetic risk for these for diabetic conditions and problems, then it's adding in those things or increasing the supplementation that allows for better sensitivity at the cell to keep the sugars going in. And that's the number one is better insulin sensitivity. And the second one is what we've been talking about. It's gut microbiome and you mentioned triglycerides earlier. But I'm going to throw another one out there, and that's called short-chain fatty acids. That's what probiotics, when they eat the fiber foods that we do, they end up with a byproduct producing a short-chain fatty acid that reduces inflammation throughout the body, not just the gut, but throughout the body.
Okay.
So a lot of different cultures will use different ways to increase their amount of their good probiotics, and a lot of people are familiar with some of them. The Japanese use miso, and then there's what other ways? In kimchi, we have in our country, cabbage, and people that or coleslaw rather, making any, and then there I believe the Russians have a way of fermenting theirs using an alcohol too. Which is interesting. But anytime you can establish the good probiotic balance between that and what's called commensal bacteria, which the bacteria that belong there already, we're going to see less inflammation. And Alzheimer's disease is an inflammatory condition. So that it's a very complex issue. But
So what I was going to ask you about. Statin drugs and their possible role in Alzheimer's. I don't know how much of the studies you've read on that. I've heard it mentioned. Do statin drugs diminish the cholesterol around neural pathways? Maybe you could touch on that before we close.
Yeah, and one of the main steroid hormones that's created from a statin drug is pregnenolone, which is the brain is abundantly full of this hormone. It's over the counter, inexpensive, but it's responsible for attention span and focus. The other thing that high dosages of statins they deplete an enzyme that our brain and our hearts need called CoQ10. Only somebody with a diagnosis or even a possibility of with genetic predisposition for Alzheimer's disease should automatically increase the CoQ10. An active diagnosis, 1,200 milligrams of CoQ10 a day. So it's a very important enzyme, and statins will deplete that. So there are associations. There are associations that statins increase your risk for diabetes, what I just said before, increasing your insulin resistance or increasing sugars, increasing diabetes. Multiple studies coming out. But what does the FDA say about that? They say that the risk for heart disease outweighs the risk for new cases of diabetes. And so that's their solution, is to leave these nasty drugs on the market and then put an excuse in there like that, when actually we can use other things that Google lipids and red rice yeast and CoQ10 and achieve the same sort of thing. Without the harmful side effects. So, but I'm glad you brought that up.
No, this has been very educational, and we could go on forever, and I'm sure we're definitely going to have you back on again. So it's been an education for Jeff and I, and hopefully some folks who are listening to this will take this stuff to heart and practice it, because I'm a true believer in what you've done for me and literally changed my life to where I can do things now that I couldn't do when I was 20 because of it. So obviously I'm very appreciative of your expertise and knowledge, buddy. And so
we're constantly trying to keep reposting things into into our website for people for just educational purposes and access, and that's acimedicine.com. It's a very basic site, but it does serve the purpose. So I will be putting things in the library as we develop them. So. But I appreciate you having me on.
All right. And Jeff, go ahead and jump back on, buddy.
Yeah, like you said, Pat, that was a wealth of information, and I'm sitting here breaking out my physician's desk reference, about ready to go to work. I mean, it's definitely one of those where you go down the rabbit hole, and it takes you down a ways. And again, man, thank you so very much, Shawn Snider, for your time. ACI, go check him out. And again, we're definitely going to have you on, because this is a conversation. It's hard to have just one, because it's quite all-encompassing.
Definitely. Thanks a lot.
Absolutely.
Well, yeah, no, it's a little too complex to cover in one thing, and one conversation, 1 hour, and so it just confirms all the stuff. And I learned a ton just from this conversation. Hopefully, the people listening to the podcast have as I said before, taken this to heart and learned some things and can fix their health issues. And you know, like they say, you can lead a horse to water, but you can't make them drink.
Absolutely.
Hopefully, everybody's going to listen to Shawn and start drinking.
Yeah, maybe we'll get some good some advice from about topics in the future, what people want to hear. You know, if we come back on, so we'll have it a little bit more focused.
Yeah, the issues definitely aren't going away, so we'll definitely do what we can to sprinkle a little bit of water on the topics when they come up. Thank you again, Shawn Snider, Pat Militich. Once again, thank you, sir. Travel safe this week as you travel, my brother. And I think we can announce it, man. We got Sean Stone coming up next, the son of Oscar award-winning Oliver Stone. We got him coming on to talk about a little bit of conspiracy and his new movie.
Good times, brother.
Good times. All right, stay tuned, ladies and gentlemen. Be well.